If you underwent oncoplastic breast reconstruction, which is reconstruction after a lumpectomy or a partial mastectomy, it's very similar to the instructions that I would give a patient that underwent a breast lift or a breast reduction. We will still give you pain medicine after surgery because you usually need something a little stronger than Tylenol. We'll either give you Percocet, Tylenol with codeine, or Vicodin, or even sometimes Dilaudid, depending on your pain threshold. It's not that painful of an operation, and most people are surprised by how well they do after surgery. If you have any anxiety, we will also give you some Valium, which will help relax you. There's really no muscle spasms. That's more for tissue expander or implant reconstruction after a mastectomy. Sometimes we give you an antibiotic and we'll give you instructions on that. And it's also a very good idea to take an over-the-counter stool softener like Colace or Senna, because sometimes you can get constipated when you're taking a narcotic pain medicine. The incision and the scarring after oncoplastic breast reconstruction will usually be on both breasts, even if you had cancer just on one side. It will either be just around the nipple and the areola, or it will be what we call a vertical pattern, which is around the areola and down to the bottom of the breast, or it could potentially be what we call a wise pattern or an anchor pattern, where it's around the nipple, down to the bottom, and then across the bottom. Either way, after surgery, you'll have surgical tape on the incisions, which you keep on until your first postoperative appointment, and then you'll have some gauze, and then you'll have a surgical bra that we place on you at the end of the operation. So the night after surgery, I do want you to unzip the bra and just fold down the gauze that are on the breasts, and you're going to want to look at both your nipples. And the reason I have you inspect your nipples the night after surgery and then the next morning is because sometimes you can have compromised blood flow to the nipples, and it's always better to know that ahead of time. If you notice that one of the nipples or even both the nipples is dark blue or purple or is pale or white compared to the other one, then you'll definitely want to call me right away, and please don't wait on that. The chance in that is very small. It's under 1%, but it's always a risk. You will likely have a drain on one side or both sides, and we have another video that will show you, which gives you instructions on how to care for the drains. After surgery, if you have any extreme pain, nausea, vomiting that doesn't go away, high fever, chills, an enlarging area, shortness of breath, chest pain, any of those symptoms, you definitely want to call either me or the breast surgeon or go to your nearest emergency room. You do want to sleep on your back after surgery. You don't want to squish your breast right after surgery. That can put tension on all the incisions. It's very important to get out of bed and walk around after surgery. You're at risk after a longer surgery and with the diagnosis of breast cancer to develop a clot in your legs known as a DVT, or deep venous thrombosis. So we will actually give you a little heparin shot while you're in the hospital, which helps decrease that risk, and we will put compression stockings on your legs, which pump the blood flow, the blood out of your legs and keep it moving. But at home, that's really up to you to get up and walk and move around. So 2 days after surgery, 48 hours, you can remove all the gauze and you can shower at that time. When you shower, you can put the lanyard around your neck that we give you instructions for how to do that in the JP Drain video. But you mostly want to keep your back toward the shower. You can get your breasts wet, but you don't want to soak them. You can wash them with soap and water gently, and then you can pad them dry. You really want to avoid any strenuous activity or exercise or lifting, pushing, pulling anything too heavy. I use the example of a gallon of milk, nothing heavier than a gallon of milk, for about 6 weeks after surgery. After about 3 to 4 weeks after surgery, you can start applying scar cream to all of the incisions, and we can give you further instructions on how to do that in the office. Mild swelling and bruising are completely normal. If you have excessive bruising on one side, or if the breasts look very off in terms of shape or size, you obviously do want to let me know and call the office if that occurs. You want to avoid all forms of nicotine after surgery, especially firsthand smoke yourself or secondhand smoke, because those can all affect healing. They can even lead to infection, some of the skin dying, the nipple not having good blood flow, and just overall problems with surgery.